Welcome back. India's vaccine arsenal will soon receive a major boost as the Pfizer vaccine could be made available in India. According to news agency Reuters, India is in talks with the vaccine manufacturer to procure 50 million doses. The drug maker has not sought approval for its vaccine so far. At the same time, India has approved Johnson & Johnson's one-shot vaccine for emergency use. So that's what's coming in on the vaccination front. Now, India's vaccine arsenal could soon receive a major boost as the Pfizer vaccine could be made available in the country. According to news agency Reuters, India is in talks with the vaccine manufacturer to procure 50 million doses. The drug maker, however, has not sought approval for its vaccine in India. At the same time, India has also approved Johnson & Johnson's one-shot vaccine for emergency use. Practically across the country, 2 vaccine doses are in use for the rollout. Those are Covaxin and Covishield. But as reports suggest, the Indian government is in talks with Pfizer to roll out its vaccine in the country. The vaccine manufacturer is likely to provide 50 million doses to the country. I'm joined by Runjhun Sharma on the broadcast. Runjhun, talks may be on with Pfizer for 50 million doses, which is a huge number, but it's a long road before we can actually get access to the vaccine.
The whole point, yes, Ayushman. In fact, 50 million doses might sound like a big fancy number, but at the end of the day, remember that Pfizer has not even applied in India yet. And as far as Moderna, for example, is concerned, that has already got emergency use authorization, in fact, 4th vaccine in India to get EUA from the Drug Controller General of India. But because the talks are stuck because of the indemnity clause, we've not even seen Moderna, which is a stock which is ready for Cipla to import from the COVAX initiative, the donated vaccines. So when will Pfizer actually make its way into the country? That is a bit of a question mark. Some details are patchy. Yes, there's a number that the report points out, 50 million doses. But the timeline, when will these doses come to India and how will they come? Who would be the partner importing these doses? Besides, remember, for now, since the drug maker has not applied to India, the DCGI cannot give an approval just as yet. So those details are patchy. For now, we're largely dependent on 2 vaccines in the country, Covishield as well as Covaxin, Ayushman. Yes, Sputnik V is there, but that's being used in a very limited, in a very, very staggered manner. So yes, we're dependent on the 2 doses, 2 vaccines for now. And Pfizer, whenever it comes, it looks like it's going to be a long road before it really makes its way into the country.
Right. Runjhun, stay with us. Now, staying with the vaccination drive, the Drug Controller General of India has given the nod to Bharat Biotech to conduct a study on the mixing of 2 of their COVID vaccines. The Hyderabad-based vaccine manufacturer will be conducting studies on Covaxin and the adenoviral intranasal vaccine. The main aim of the study is to evaluate the immune response and safety of the jabs if mixed. This will be the second combination of vaccines to be studied after mixing studies of Covishield and Covaxin. Runjhun continues to be with us on the broadcast. Runjhun, what does the initial data suggest when it comes to the mixing of vaccine doses?
Very, very encouraging. Remember, the ICMR, in fact, had done a study on a handful of people, 18 to be precise, Ayushman, on a group of villagers from Siddharth Nagar in Uttar Pradesh who by accident got mix and match of Covishield and Covaxin. It really was miraculous that not only were these people safe, but it generated a potent immune response in these participants. In fact, if you compare it to 2 doses of Covishield or 2 doses of Covaxin, it had a much, much better response. In fact, even the mix and match of the 2 doses responded well to the mutant strain. So it sounds like a win-win situation. But yes, formal studies need to be conducted before India can finally, apply it, the mix and match of the 2 vaccines into the country, because there has to be a full study, a formal study which needs to be conducted. the DCGI had given permissions to Christian Medical College in Vellore to conduct a mix and match on Covishield and Covaxin. And now we're also learning the DCGI has given a go-ahead to Bharat Biotech to conduct the study for Covaxin and their intranasal vaccine. Now, Covaxin is an injectable vaccine already being administered in the country, while intranasal vaccine is still being developed by Bharat Biotech. It's a nasal vaccine, it's a single dose vaccine, so it's going to be very interesting, Ayushman. It's going to be the first of its kind of study, but the Bharat Biotech is hopeful that it will have good results.
Runjan, stay with us. We're getting a piece of breaking news. The latest figures from the Union Health Ministry. India has reported 41,195 new cases in the last 24 hours, a marginal rise from yesterday's numbers. So that's what's coming in from the Union Health Ministry. 41,195 new cases in the past day, as well as 490 fatalities have been reported in the past day. Runjun, decode the numbers for us. We continue to hover around that 40,000 mark on a daily basis.
Yes, in fact, it's been over a month now, Ayushman, and the numbers keep hovering around that 40,000 mark. For the last couple of days, we've seen that the numbers had dipped down, in fact, even till the 30,000 mark, but they are back to the 40,000 mark, in fact, above 40,000 is what we're reporting from a single day tally today. A considerable amount of these cases are coming from the southern state of Kerala, about 50% of them, which the government feels is a cause of concern. There are central teams that are visiting some of these states to take a stock of the situation, to handhold the state governments in making sure that the virus, in fact, is not being spread, because it's going to spill over, and this really could be a problem, considering India is staring at a third wave any which way. Ayushman, different experts have given different timelines for when this third wave could hit India. But currently, again, we're hovering around that 40,000 mark. The active caseload, though, in the country is a little below that 4 lakh mark. So that's a good sign. But we will have to wait and watch and analyze for a couple of weeks where these numbers are going, because remember, there's a festival in Kerala. Kerala already is reporting a lot of numbers. Then there are other states, some of the northeastern states like Assam, Mizoram. They are problem areas. So is Karnataka. There's Odisha. There's Tamil Nadu. So the situation is worrisome, and the government maintains that the second wave is still not over.
Right. Thank you, Runjan, for getting us the latest on the COVID front when it comes to the vaccination drive and the rise in daily cases. And as Runjan was pointing out, 50% of the new cases on a daily basis come from Kerala, and ahead of Onam, tourism has restarted in the state. But strict COVID protocols are in place because cases are showing no signs of dipping. Neetu Rayukumar gets us this report.
The lush green Ponmudi Hills in Thiruvananthapuram is a perfect getaway, and it's finally reopened for tourists, provided they are vaccinated or have a negative RT-PCR report which is not more than 72 hours old.
Next Saturday പോവാണ്. അപ്പോൾ അതിന് മുന്നേ വൺ ഡേയും കൂടെ എങ്ങോട്ടെങ്കിലും പോകണമെന്നുണ്ടായിരുന്നു. അപ്പോഴാണ് ഇങ്ങനെ ഇവിടെയെല്ലാം ഓപ്പൺ ആയി എന്ന് അറിഞ്ഞത്. അപ്പോൾ ജസ്റ്റ് ഫാമിലി ആയിട്ട് എല്ലാവരുമായിട്ട് വന്നു, അത്രയേ ഉള്ളൂ. ഉറപ്പായിട്ടും മോന് പുറത്ത് പോകാനൊക്കെ ഉള്ള ചാൻസസ് ഒക്കെ കുറവാണ്. അപ്പോൾ ഇങ്ങനെ വല്ലപ്പോഴും ഒക്കെയാണ് ഇങ്ങനെ പുറത്തോട്ടൊക്കെ പോകുന്നത്. അപ്പം അവനും വളരെ ഹാപ്പി ആയിരിക്കും അതുകൊണ്ട്.
Those whose livelihood depends on tourism are hoping for business to pick up, especially during Onam.
വീട്ടിലെ എല്ലാവരും ഇരുന്ന് ശരിക്കും പറഞ്ഞു കഴിഞ്ഞാൽ വീർപ്പ് മുട്ടയാണ്. നമ്മളും വീട്ടിലിരുന്നപ്പോഴത്തേക്കാണ് ആ ബുദ്ധിമുട്ട് മനസ്സിലായത്. പിന്നെ അവരെ പോലുള്ളവർ വന്നാലേ നമ്മുടെ ജീവിതമാർഗം കൂടെ പോവുള്ളൂ. അപ്പം എല്ലാവരും ബീച്ചിലോട്ട് വരണമെന്നാണ് കച്ചവടക്കാരനെന്നുള്ളത് നമ്മുടെ ആഗ്രഹം. അവർക്ക് കുറച്ച് തുറസായ കാറ്റൊക്കെ കൊള്ളാൻ ചെയ്യാം. തീർച്ചയായിട്ടും മാസ്ക് വയ്ക്കുന്നുണ്ട്. സാമൂഹികമായിട്ട് അകലം പാലിക്കാൻ ഒരുപാട് സ്ഥലമുള്ള ഒരു സ്ഥലമാണ്.
Tourism has typically been a major source of income for Kerala. The state suffered an estimated loss of about 33,000 crore last year. While things are finally looking up, the state government says safety is a priority and have created a bio bubble for tourists.